Welcome to Clinique RN, your ultimate Nclex study partner. Today, we're diving into mental health nursing, covering 30 high-yield Nclex questions with detailed rationales and in-depth teaching on each central topic. These are real-life scenarios that could appear on your exam. Grab your notes and let's get started. Question 1. Therapeutic communication. A patient with major depressive disorder, MDD, tells the nurse, "I feel like a burden to everyone." What is the best response? A. You shouldn't feel that way. You have people who love you. B. Why do you feel like a burden? C. That sounds really difficult. Tell me more about what you're feeling. D. Let's talk about something positive instead. Correct answer. C. That sounds really difficult. Tell me more about what you're feeling. Rationale. This response uses therapeutic communication by encouraging the patient to express feelings without judgment. It shows active listening and empathy. Incorrect answers. A. You shouldn't feel that way. Minimizes feelings and shuts down conversation. B. Why do you feel like a burden? Sounds accusatory, making the patient defensive. D. Let's talk about something positive instead. Avoids the patient's distress instead of addressing it. Deep dive. Therapeutic communication in mental health. Effective communication is the foundation of psychiatric nursing. Always use open-ended questions, active listening, and validation instead of giving advice or minimizing emotions. Question 2. Suicide risk assessment. A patient with severe depression says, "I wish I could go to sleep and never wake up." What is the nurse's priority response? A. Are you thinking about hurting yourself? B. You will feel better soon. Just give it time. C. Do you want to talk about something else? D. That's not a good way to think. Try to be more positive. Correct answer. A. Are you thinking about hurting yourself? Rationale. Directly assessing suicidal thoughts does not increase the risk of suicide. Instead, it opens communication and helps the nurse determine risk level. Incorrect answers. B. You will feel better soon. Minimizes the patient's distress and offers false reassurance. C. Do you want to talk about something else? Avoids the issue instead of assessing risk. D. That's not a good way to think. Invalidates the patient's feelings. Deep dive. Suicide. Risk assessment. Always assess for intent, plan, means, and time frame. If the patient has a specific plan and means, immediate hospitalization is required to ensure safety. Question 3. Schizophrenia. Hallucinations. A patient with schizophrenia tells the nurse, "The voices are telling me to harm myself." What is the priority nursing action? A. Ask, "What are the voices saying?" B. Tell the patient, "Those voices aren't real." C. Change the subject to distract the patient. D. Encourage the patient to ignore the voices. Correct answer. A. Ask, "What are the voices saying?" Rationale. It's critical to assess auditory hallucinations, especially command hallucinations that instruct the patient to harm themselves or others. Incorrect answers. B. Those voices aren't real. Invalidates the patient's experience. C. Change the subject. Ignores the issue instead of addressing it. D. Encourage the patient to ignore the voices. Does not help manage symptoms safely. Deep dive. Hallucinations versus delusions in schizophrenia. Hallucinations are false sensory perceptions, while delusions are false fixed beliefs. Always assess for command hallucinations as they pose a serious safety risk. Question 4. Panic attack management. A patient experiencing a panic attack is hyperventilating and states, "I feel like I'm dying." What should the nurse do first? A. Instruct the patient to take slow, deep breaths. B. Leave the patient alone to calm down. C. Tell the patient, "You are not dying." D. Encourage the patient to talk about their stresses. Correct answer. A. Instruct the patient to take slow, deep breaths. Rationale: panic attacks cause hyperventilation, dizziness, and chest tightness. Controlled breathing lowers anxiety and restores oxygen balance. Incorrect answers: B. Leave the patient alone. Never leave a patient in crisis alone. C. You are not dying. Minimizes the patient's experience. D. Encourage discussion. Helpful later, but breathing control comes first. Deep dive: anxiety disorders. Panic attacks are sudden episodes of intense fear. Nursing interventions include deep breathing, grounding techniques, and reassurance without invalidation. Question 5. Bipolar disorder, mania. A patient with bipolar disorder is hyperactive, pacing and talking non-stop. What is the priority nursing intervention? A. Encourage the patient to sit and relax. B. Offer high-calorie finger foods and fluids. C. Ask the patient to stop pacing. D. Encourage the patient to discuss their feelings. Correct answer: B. Offer high-calorie finger foods and fluids. Rationale: during a manic episode, patients have high energy but poor nutritional intake. Providing high-calorie, portable foods ensures adequate nutrition. Incorrect answers: A. Encourage sitting down. Unrealistic for manic patients. C. Ask the patient to stop pacing. Avoid power struggles. Instead, provide safe outlets for energy. D. Encourage discussion. Manic patients have racing thoughts and may not engage effectively. Deep dive: bipolar disorder, manic phase. Manic patients need structure, nutrition, and low stimulation environments. Avoid arguments and set clear limits. Question 6. Obsessive compulsive disorder, OCD. A patient with OCD repeatedly washes their hands for hours daily, causing skin breakdown. What is the priority nursing intervention? A. Stop the patient from washing their hands. B. Encourage the patient to verbalize their anxiety. C. Set time limits for hand washing and gradually decrease them. D. Allow unlimited time for hand washing to reduce stress. Correct answer: C. Set time limits for hand washing and gradually decrease them. Rationale: patients with OCD perform compulsions to relieve anxiety. The best intervention is gradual. Exposure and response prevention therapy, setting limits while reducing anxiety. Incorrect answers: A. Stop the patient from washing their hands. Abruptly stopping compulsions increases anxiety. B. Encourage verbalizing anxiety. Helpful, but does not reduce compulsions. D. Allow unlimited hand washing. Reinforces the compulsive behavior. Deep dive: OCD and nursing care. OCD is an anxiety disorder where patients have intrusive thoughts, obsessions, and feel compelled to perform rituals. Compulsions. Gradual exposure and behavioral therapy are key. Question 7. Borderline personality disorder, BPD. A patient with borderline personality disorder frequently threatens self-harm and states, "No one cares about me. Maybe I should just end it all." What is the priority intervention? A. Offer emotional support and encourage expression of feelings. B. Ignore the threats to discourage attention-seeking behavior. C. Implement one-on-one supervision and ensure patient safety. D. Encourage the patient to think positively. Correct answer: C. Implement one-on-one supervision and ensure patient safety. Rationale: patients with BPD often engage in self-harm or suicidal gestures as a way to regulate emotions. Ensuring safety is always the priority. Incorrect answers: A. Offer emotional support. Important, but safety comes first. B. Ignore the threats. Never ignore suicidal ideation. D. Encourage positivity. Minimizes the patient's distress. Deep dive. Borderline personality disorder. BPD is characterized by unstable relationships, self-harm, and emotional dysregulation. Dialectical behavior therapy, DBT, is the best treatment. Question 8. Alcohol withdrawal. A patient is 8 hours post-op and vomiting, tremulous, and anxious after reporting daily alcohol use for 10 years. What is the priority intervention? A. Encourage deep breathing to reduce anxiety. B. Monitor for seizures and administer benzodiazepines. C. Offer reassurance and hydration. D. Keep the room quiet to reduce overstimulation. Correct answer. B. Monitor for seizures and administer benzodiazepines. Rationale. Alcohol withdrawal begins 6 to 24 hours after the last drink and can lead to seizures or delirium tremens, DTs. Benzodiazepines, e.g. lorazepam, diazepam, prevent seizures. Incorrect answers. A. Encourage deep breathing. Does not treat withdrawal. C. Offer thorough reassurance. Helpful, but not the priority. D. Keep the room quiet. Good for DTs, but seizures take priority. Deep dive. Alcohol withdrawal syndrome. Symptoms range from tremors and anxiety, mild to seizures, hallucinations and delirium tremens, severe. Benzos are the gold standard. Question 9. Anorexia nervosa. A 15-year-old with anorexia nervosa has hypertension, blood pressure 80/50, bradycardia, heart rate 48, and hypokalemia, potassium plus 2.8. What is the priority intervention? A. Monitor vital signs every 8 hours. B. Offer high-calorie, high-protein meals. C. Initiate continuous cardiac monitoring. D. Encourage family participation in meals. Correct answer. C. Initiate continuous cardiac monitoring. Rationale. Severe anorexia can cause life-threatening cardiac arrhythmias due to electrolyte imbalances, especially hyperkalemia. Incorrect answers. A. Monitor vitals every 8 hours. Too infrequent for critical patients. B. Offer high-calorie meals. Needed, but cardiac monitoring takes priority. D. Encourage family participation. Helpful, but not priority. Deep dive. Anorexia and cardiac risks. Anorexia nervosa can lead to cardiac arrest due to electrolyte imbalances. Refeeding syndrome is also a risk. Start nutrition slowly. Question 10. Dementia versus delirium. A 75-year-old patient with sudden confusion, agitation, and hallucinations is brought to the ER. The family states, she was fine yesterday. What is the most likely cause? A. Dementia. B. Delirium. C. Depression. D. Normal aging. Correct answer. B. Delirium. Rationale. Delirium is a sudden onset of confusion caused by infection, medications, or metabolic imbalances. Incorrect answers. A. Dementia. Dementia develops slowly, not suddenly. C. Depression. Can mimic dementia but does not cause hallucinations. D. Normal aging. Sudden confusion is never normal. Deep dive. Dementia versus delirium. Dementia equals slow and progressive. Delirium equals sudden and reversible. Always check for UTIs, electrolyte imbalances, or medication side effects in elderly patients. Question 11. Paranoid schizophrenia. Nursing approach. A patient with paranoid schizophrenia believes the hospital staff is poisoning their food. What is the best nursing response? A. That's not true. We would never do that. B. I understand that you believe that, but your food is safe. C. If you don't want to eat, that's your choice. D. Why do you think we would poison your food? Correct answer. B. I understand that you believe that, but your food is safe. Rationale. This response uses therapeutic communication, acknowledging the patient's feelings without reinforcing the delusion. Incorrect answers. A. That's not true. Directly contradicting the delusion increases mistrust. C. It's your choice. Dismissive and does not address paranoia. D. Why do you think that? May make the patient feel more suspicious. Deep dive. Paranoid schizophrenia. These patients have fixed false beliefs, delusions. The goal is to acknowledge their reality without reinforcing it while ensuring safety. 12. Post-traumatic stress disorder, PTSD. A veteran experiencing PTSD suddenly shouts and dives under a table during fireworks. What is the best nursing intervention? A. Tell the patient, you're safe and this is not a war zone. B. Encourage deep breathing and grounding techniques. C. Restrain the patient to prevent self-harm. D. Leave the patient alone to calm down. Correct answer. B. Encourage deep breathing and grounding techniques. Rationale. PTSD flashbacks can make a patient feel like they are reliving a traumatic event. Grounding techniques, e.g., focusing on the present, help bring them back to reality. Incorrect answers. A. This is not a war zone. Minimizes their distress. C. Restrain the patient. Unnecessary unless they are violent. D. Leave the patient alone. Could worsen distress. Deep dive. PTSD and flashbacks. Flashbacks are an involuntary re-experience of trauma. Grounding techniques include deep breathing, describing surroundings, and engaging the five senses. 13. Selective serotonin reuptake inhibitors, SSRIs. Which symptom suggests serotonin syndrome, a potentially life-threatening complication of SSRIs, e.g. fluoxetine, sertraline? A. Muscle rigidity, fever, agitation. B. Dry mouth, urinary retention, blurred vision. C. Bradycardia, hypertension, confusion. D. Weight gain, fatigue, constipation. Correct answer. A. Muscle rigidity, fever, agitation. Rationale. Serotonin syndrome is caused by excess serotonin and presence with hypothermia, high fever, hyperreflexia, muscle rigidity, tremors, autonomic instability, tachycardia, hypertension. Incorrect answers. B. Dry mouth, urinary retention, anticholinergic symptoms caused by TCAs, not SSRIs. C. Bradycardia, hypertension, seen in opioid overdose, not serotonin syndrome. D. Weight gain, fatigue, common side effects but not dangerous. Deep dive. Serotonin syndrome. Serotonin syndrome can occur with SSRIs, SNRIs, MAOIs, or St. John's wort. Treatment includes discontinuing the drug and administering benzodiazepines or cyproheptadine, serotonin antagonists. 14. Bipolar disorder. Manic episode. A patient in a manic episode is shouting, pacing, and throwing furniture. What is the priority nursing intervention? A. Offer the patient food and fluids. B. Set firm limits and remove dangerous objects. C. Encourage the patient to talk about their feelings. D. Allow the patient to vent freely. Correct answer. B. Set firm limits and remove dangerous objects. Rationale. Patients in mania can be impulsive and aggressive, so ensuring safety is the priority. Incorrect answers. A. Offer food. Helpful later, but safety comes first. C. Encourage talking. Manic patients have racing thoughts and may not focus. D. Allow venting may escalate aggression. Deep dive. Managing mania. Manic episodes require structured environments, limit setting, and safety precautions to protect both the patient and staff. 15. Violence risk, escalation stages. A patient is yelling, clenched fists, and pacing. What is the best de-escalation strategy? A. Stand close to the patient to show support. B. Use a calm, low-tone voice and set limits. C. Call security immediately. D. Restrain the patient before they become aggressive. Correct answer. B. Use a calm, low-tone voice and set limits. Rationale. De-escalation techniques help prevent violence and maintain patient dignity. Incorrect answers. A. Stand close. Can be threatening. Maintain personal space. C. Call security. Used if de-escalation fails. D. Restrain immediately. Only if the patient becomes violent. Deep dive. The assault cycle. Agitation, verbal escalation, physical aggression, recovery. Intervene early with de-escalation. Question 16. Borderline personality disorder. Splitting. A patient with borderline personality disorder, BPD, tells the nurse, "You're the only good nurse here. The others are terrible." What is the best nursing response? A. Thank you for saying that. B. You should not say that about the other nurses. C. I understand that you feel this way, but all staff members are here to help you. D. Let's focus on the positives instead. Correct answer. C. I understand that you feel this way, but all staff members are here to help you. Rationale. Patients with BPD use splitting, seeing people as either all good or all bad. The nurse should set clear and consistent boundaries while maintaining therapeutic communication. Incorrect answers. A. Thank you for saying that. Reinforces splitting behaviour. B. You should not say that. Sounds dismissive. D. Let's focus on the positives. Avoids addressing the behaviour. Deep dive. Splitting in borderline personality disorder. Splitting is a defence mechanism where patients see things in extremes. Consistency among the healthcare team is crucial. 17. Lithium toxicity signs. A patient taking lithium for bipolar disorder reports tremors, confusion, and nausea. What is the nurse's priority action? A. Administer activated charcoal. B. Discontinue lithium and notify the provider. C. Increase sodium intake. D. Encourage fluid intake. Correct answer. B. Discontinue lithium and notify the provider. Rationale. Lithium toxicity occurs when levels exceed 1.5 milliequivalents per litre, causing neurological symptoms, tremors, and gastrointestinal distress. Incorrect answers. A. Administer activated charcoal, not effective for lithium toxicity. C. Increase sodium intake, helps prevent toxicity but does not treat it. D. Encourage fluid intake, important but not the priority action. Deep dive. Lithium, toxicity, and Nclex tips. Lithium is excreted by the kidneys. Toxicity risk increases with dehydration, NSAIDs, and low sodium levels. Always monitor blood levels. 18. Bulimia nervosa characteristics. Which behaviour is most characteristic of bulimia nervosa? A. Self-induced vomiting after eating large amounts of food. B. Significant weight loss and refusal to eat. C. Body dysmorphia and avoidance of mirrors. D. Compulsive exercise without purging behaviours. Correct. Answer. A. Self-induced vomiting after eating large amounts of food. Rationale. Bulimia involves binge eating followed by purging behaviours, including vomiting, laxative abuse, or excessive exercise. Incorrect answers. B. Significant weight loss. More common in anorexia. C. Body dysmorphia. Seen in eating disorders, but not exclusive to bulimia. D. Compulsive exercise. Can be seen in bulimia, but without purging, it's more likely an exercise disorder. Deep dive. Bulimia versus anorexia. Bulimia patients often have a normal weight or are slightly overweight, unlike anorexia patients who have severe weight loss. Question 19. Schizophrenia. Medication refusal. A patient with schizophrenia refuses medication, saying, "The government is trying to poison me." What is the best nursing response? A. That's not true. Your medications are safe. B. I understand this is concerning for you. Let's discuss your fears. C. If you don't want to take them, that's your choice. D. Why do you think that? Correct answer. B. I understand this is concerning for you. Let's discuss your fears. Rationale. This response acknowledges the patient's fear without reinforcing the delusion while promoting open communication. Incorrect answers. A. That's not true. Invalidates the patient's belief. C. It's your choice. Non-therapeutic and does not address concerns. D. Why do you think that? Could increase paranoia. Deep dive. Nursing care for delusions. Do not argue with delusions. Instead, focus on building trust and encouraging reality-based thinking. Question 20. Suicide risk warning sign. A patient with major depression has been withdrawn for weeks, but suddenly appears happy and talkative. What should the nurse suspect? A. The patient's depression is improving. B. The patient is at increased risk for suicide. C. The patient is ready for discharge. D. The patient is responding well to medication. Correct answer. B. The patient is at increased risk for suicide. Rationale. Sudden mood improvement in depressed patients can indicate they have made a decision to end their life. Incorrect answers. A. Depression is improving. Sudden mood changes require closer assessment. C. Ready for discharge, not without a full risk assessment. D. Responding to medication. Antidepressants take weeks to work. Deep dive. Suicide. Warning signs. Watch for sudden relief, giving away possessions and discussing death. These are major red flags for suicide risk. 21. Panic disorder. First-line treatment. A patient with panic disorder reports frequent episodes of chest tightness, dizziness, and heart palpitations, often triggered by stress. What is the first-line medication treatment? A. Benzodiazepines, e.g. alprazolam, lorazepam. B. Selective serotonin reuptake inhibitors, SSRIs. C. Beta blockers, e.g. propranolol. D. Atypical antipsychotics, e.g. risperidone. Correct answer. B. Selective serotonin reuptake inhibitors, SSRIs. Rationale. SSRIs, e.g. fluoxetine, sertraline, escitalopram, are the first-line treatment for panic disorder because they help regulate serotonin levels, reducing anxiety long-term. Incorrect answers. A. Benzodiazepines. Effective for short-term relief, but not first-line due to addiction risk. C. Beta blockers. Help with physical symptoms, but don't treat the root cause. D. Atypical antipsychotics, not used for panic disorder. Deep dive. Panic disorder. Management. Panic attacks cause intense fear, hyperventilation, and palpitations. Treatment includes SSRIs, cognitive behavioral therapy, CBT, and relaxation techniques. 22. Post-traumatic stress disorder, PTSD. Flashback management. A patient with PTSD suddenly begins shouting and ducking under a table in response to a loud noise. What is the best nursing intervention? A. Use grounding techniques and reassure the patient. B. Restrain the patient to prevent harm. C. Ask the patient, what are you afraid of? D. Instruct the patient to take deep breaths. Correct. Answer. A. Use grounding techniques and reassure the patient. Rationale. Flashbacks make PTSD patients feel as if they are reliving their trauma. Grounding techniques, e.g. holding a cold object, describing the environment, help bring them back to the present moment. Incorrect answers. B. Restrain the patient. Restraints worsen distress unless absolutely necessary. C. Ask about fear. Not effective during an active flashback. D. Deep breathing. Helps anxiety, but grounding is more effective for flashbacks. Deep dive. PTSD and grounding techniques. PTSD flashbacks disconnect the patient from reality. Techniques like naming objects in the room, touching a textured item, and breathing exercises help anchor them in the present. 23. negative symptoms of schizophrenia. Which statement by a patient with schizophrenia suggests negative symptoms of the disorder? A. I keep hearing voices telling me to do things. B. I haven't felt like talking to anyone for weeks. C. The government implanted a chip in my brain. D. I keep seeing shadows moving in the room. Correct answer. B. I haven't felt like talking to anyone for weeks. Rationale. Negative symptoms include social withdrawal, apathy, anhedonia, inability to feel pleasure, and flat affect. Incorrect answers. A. Hearing voices, auditory hallucination, positive symptom. C. Government implant belief, delusion, positive symptom. D. Seeing shadows, visual hallucination, positive symptom. Deep dive, positive versus negative symptoms of schizophrenia. Positive symptoms equals hallucinations, delusions, disorganized speech. Negative symptoms equals lack of emotion, withdrawal, reduced speech. Treatment is different for each. Question 24. Alcohol withdrawal. Priority medication. A patient with a history of alcohol use disorder is experiencing tremors, anxiety, and hypertension 8 hours after their last drink. What medication should the nurse administer? A. Naloxone. B. Benzodiazepine, e.g. lorazepam, diazepam. C. Disulfiram. D. Haloperidol. Correct answer. B. Benzodiazepine, e.g. lorazepam, diazepam. Rationale. Benzodiazepines prevent seizures and manage alcohol withdrawal symptoms. Incorrect answers. A. Naloxone, used for opioid overdose, not alcohol withdrawal. C. Disulfiram, causes alcohol intolerance, not used for withdrawal. D. Haloperidol, not effective for withdrawal. Deep dive, alcohol withdrawal, timeline and treatment. Symptoms peak at 24 to 48 hours, and delirium tremens, DTs, can occur after 48 hours, causing seizures and hallucinations. Benzodiazepines are the standard treatment. Question 25. Agoraphobia. Best treatment approach. A patient with agoraphobia refuses to leave their home due to intense fear of public places. What is the best nursing intervention? A. Encourage gradual exposure to feared situations. B. Force the patient to go outside for therapy. C. Tell the patient to face their fears. D. Ignore the behavior to avoid reinforcing it. Correct answer. A. Encourage gradual exposure to feared situations. Rationale. Systematic desensitization, gradual exposure therapy, is the most effective treatment for phobias. Incorrect answers. B. Force the patient outside, traumatizing and ineffective. C. Face your fears, too vague and unhelpful. D. Ignore the behavior, avoidance reinforces fear. Deep dive, agoraphobia and treatment. Gradual exposure therapy starts with low-stress situations and builds up to feared environments, increasing confidence over time. Question 26. Obsessive-compulsive personality disorder, OCPD. A patient with obsessive-compulsive personality disorder, OCPD, is upset because a coworker rearranged their desk at work. The patient states, "Everything has to be in order or I can't focus." What is the best nursing approach? A. Encourage flexibility in daily routines. B. Tell the patient that workplace changes are unavoidable. C. Offer medication to reduce obsessive thoughts. D. Allow the patient to rearrange the desk to reduce anxiety. Correct answer. A. Encourage flexibility in daily routines. Rationale. Patients with OCPD, not OCD, have a rigid, perfectionist personality and struggle with change. The best approach is to gently encourage flexibility while maintaining their sense of control. Incorrect answers. B. Tell the patient that changes are unavoidable. This may increase distress instead of helping. C. Offer medication. OCPD is best treated with behavioral therapy, not just meds. D. Allow desk rearrangement. This reinforces rigid behavior instead of promoting adaptability. Deep dive. OCPD versus OCD. OCPD is a personality disorder focused on perfectionism and control, while OCD is an anxiety disorder with intrusive thoughts and compulsions. 27. Anorexia nervosa. Priority goal. A patient with anorexia nervosa has a BMI of 16, bradycardia, HR 48, and hypertension, BP 80/50. What is the priority nursing goal? A. Encourage the patient to eat meals with family. B. Restore nutritional status and prevent complications. C. Help the patient develop a positive body image. D. Encourage the patient to journal about their feelings. Correct answer. B. Restore nutritional status and prevent complications. Rationale. The priority in severe anorexia is nutritional rehabilitation and preventing complications like electrolyte imbalances, cardiac issues, and organ failure. Incorrect answers. A. Encourage family meals. Supportive, but physical recovery comes first. C. Develop a positive body image, important later, but not the priority. D. Encourage journaling, helps emotionally, but does not address malnutrition. Deep dive. Anorexia, nervosa, and medical risks. Severe anorexia leads to cardiac arrhythmias, hypertension, and electrolyte imbalances. Always treat the medical complications first. 28. Command hallucinations. Priority action. A patient with schizophrenia states, "The voices are telling me to harm myself." What is the nurse's priority? A. Ask, "What are the voices saying exactly?" B. Encourage the patient to listen to music instead. C. Tell the patient, "Those voices aren't real." D. Leave the patient alone to rest. Correct. Answer. A. Ask, "What are the voices saying exactly?" Rationale. Assessing the content of hallucinations is critical, especially if they involve self-harm or violence. Incorrect answers. B. Encourage listening to music. Helpful for non-dangerous hallucinations, but not a priority for safety. C. Tell the patient, "Those voices aren't real." Invalidates their experience and reduces trust. D. Leave the patient alone. Unsafe. Never leave a patient experiencing command hallucinations alone. Deep dive. Command. Hallucinations and suicide risk. Always assess for self-harm risk in schizophrenia. Patients with command hallucinations may feel compelled to obey voices. 29. Clozapine, Clozaril. Major side effect. A patient taking Clozapine, Clozaril for treatment. Resistant schizophrenia reports a sore throat and fever. What is the nurse's priority action? A. Administer acetaminophen for fever. B. Reassure the patient that this is a common side effect. C. Check the patient's white blood cell, WBC count. D. Increase fluid intake to prevent dehydration. Correct answer. C. Check the patient's white blood cell, WBC count. Rationale. Clozapine can cause agranulocytosis, dangerously low WBC count, leading to life-threatening infections. A sore throat and fever are early signs. Incorrect answers. A. Give acetaminophen, treats symptoms but does not address the cause. B. Reassure the patient, never ignore potential agranulocytosis. D. Increase fluids, does not address immune suppression. Deep dive. Clozapine and agranulocytosis. Clozapine requires regular WBC monitoring. Patients with low WBCs must stop the medication immediately. Question. 30. Opioid withdrawal. Medication management. A patient experiencing opioid withdrawal has diaphoresis, sweating, tremors, nausea, and muscle pain. What medication should the nurse anticipate administering? A. Naloxone. B. Methadone. C. Haloperidol. D. Fluoxetine. Correct answer. B. Methadone. Rationale. Methadone is a long-acting opioid used to reduce withdrawal symptoms and prevent cravings. It helps stabilize patients safely. Incorrect answers. A. Naloxone. Used for opioid overdose, not withdrawal. C. Haloperidol, not for opioid withdrawal. D. Fluoxetine. SSRI for depression, not withdrawal. Deep dive. Opioid. Withdrawal and treatment. Opioid withdrawal is painful but not life-threatening. Methadone or buprenorphine, Suboxone, are first-line treatments. That's it for our Nclex mental health review. If this helped, don't forget to like, comment, and subscribe for more high-yield nursing content. Let me know which topic you want next. See you in the next video, future RNs.